Now, I want to discuss something that could affect you, especially your healthcare expenses. It's called the Inflation Reduction Act. Now, I know that name might sound a bit dry, but trust me, this can have a tangible impact on your wallet. The Inflation Reduction Act was designed to tackle inflation and provide some relief to folks like you and me. One of the key areas this act addresses is the cost of prescription drugs. If you're like many people, you might be worried about how much you're spending on medications. The good news is that this act has made some critical changes to help lower those costs. For example, it allows Medicare to negotiate prices for certain high-cost drugs. That means you might see a reduction in what you're paying for your prescriptions. Another aspect of the act is the cap on out-of-pocket costs for medications. Starting in 2025, there's going to be a limit on how much you can spend out-of-pocket for covered drugs. This cap is a huge relief and can help you budget more effectively. The act also provides more support for preventive services. This means you can get certain vaccines and screenings at no cost, helping you stay healthy without worrying about additional expenses. I know navigating these changes can feel overwhelming, but that's why we're here. The cost of prescription drugs is a big concern, so what are other people thinking? First off, you're not alone in feeling this way. Did you know that 82% of adults think the cost of prescription drugs is unreasonable? And about 30% of people, just like you, have had to skip or adjust their medication in the past year because it was too expensive. That's a significant number, and it's a real issue. Also, 28% of adults say it is tough for them to afford to pay for their prescription drugs. The good news is that changes on the horizon could help alleviate some of this stress. The Inflation Reduction Act, which I've mentioned before, is one such change. It aims to make prescription drugs more affordable and accessible for everyone, especially for those on Medicare. I understand these issues can feel overwhelming, and having a trusted resource to help you navigate them is crucial. If you want advice on managing your prescription costs, I'm here. We aim to ensure you have all the information you need to make the best decisions for your health and budget. The government sees the Inflation Reduction Act as a real solution to some of the challenges Medicare beneficiaries have faced. This act was created to provide meaningful financial relief and bring some much-needed improvements to Medicare. So, what's in it for you? First, let's talk about access. The act was designed to increase your access to treatments and expand the services available under Medicare. This means you'll have more options when it comes to your healthcare, which can lead to better outcomes and peace of mind, knowing that the care you need is within reach. Next, there's affordability. We all know that healthcare costs can add up quickly, especially when it comes to prescription drugs. The Inflation Reduction Act aims to lower those costs by allowing Medicare to negotiate prices for certain expensive medications. Plus, it's also limiting how much drug prices can increase each year. So, you can expect more predictable costs and fewer surprises at the pharmacy. Finally, this act is about making the Medicare program more sustainable, not just for today but for the long run. By addressing some of the financial challenges within the program, the government hopes to ensure that Medicare remains strong and reliable for years to come. That means you can feel more secure knowing that the benefits you depend on will be there when you need them. Let's talk about some important changes coming your way through the Inflation Reduction Act, specifically around Medicare Part D. Now, I know Medicare can sometimes feel like a maze, but these updates are really designed to make things a bit easier, and hopefully a bit lighter on your wallet too.